Hamstring injuries are also a very common injury that we see in all of sports. This can be both in the weekend warrior or the recreational athlete, all the way up to the elite athlete at the international level. We've seen it at World Cups that we've been at. We've seen it at youth soccer games, youth football games. Unfortunately, this is an injury that does not spare any level athlete or any skill level of an athlete. With a hamstring injury, there are really two main parts of the anatomy. One is the muscle and the other are the tendons. With the muscle, that's the majority of the hamstring, and it's the part that people most commonly injured, and it's the part that's in the center of the thigh, in the back of the thigh. The tendons insert onto the bone, both in the pelvis and in the knee. So the hamstring starts as a tendon where it begins on the pelvis, specifically at a bone called the ischium, and then it becomes the muscle, and then it ends as a tendon at the knee that wraps around to the front and the side of the knee so that the hamstring is attached both above and below, and then the muscle in the middle. In all three areas, you can suffer injury. The most common is in the muscle, and that just about 100% of the time can be managed conservatively. Muscle heals, and the time it takes to heal is purely dependent on how bad the injury was. A mild strain can take a week or two to get better, whereas a more severe strain where the muscle actually tears can take up to 6 weeks to get better. So again, looking at it from an athlete's competition status, it's going to depend on just how bad the injury was as to how long they're going to miss time before they can go back to playing. There are a number of ways to speed up the healing process, and some are basic supportive measures such as ice and anti-inflammatories, and wrapping such as an ACE wrap around the thigh. However, also the physical therapists are excellent at helping get an athlete back quicker because they can do some strategies to help decrease the time as well as improve the chance of not re-injuring that muscle, because by far the biggest risk is re-injury, whether just from bad luck or going back too soon. The more challenging injuries are when it involves the tendon. So if the tendon gets pulled off of either of the bones, the question is how severe an injury is that, and should it be fixed? Luckily, when it pulls off the bone at the knee level, it usually doesn't need anything too aggressive, as it often heals on its own. Therefore, the one injury that might require a bigger treatment plan is if the hamstring is pulled off the pelvis, and that's a big, thick tendon that attaches to the ischium, and we do see where it will pull off the bone and then retract back into the thigh. It can happen from a fall, it can happen from trying to lift a heavy object, it can happen from activities such as water skiing or snow skiing, and in that setting we then have to decide whether we should consider trying to put the tendon back on the bone, and the decision on that factors in a number of elements. One is age, two is how far off the bone is it, three would be how many of the tendons are involved, as there are 3 tendons that insert onto that bone, and if we only injure 1 or 2 but they're not significantly retracted, we can often treat that conservatively. When they are significantly retracted and clearly affecting function, then we sometimes have to do a surgery to go in and put those tendons back onto the bone. And of all the hamstring injuries, that's the injury that's going to take the longest for someone to recover from, whether it's from day-to-day activities or an athlete trying to get back into athletics, and that could take up to 6 months to recover from. The nice thing about hamstring injuries is just about all of them can lead to a full recovery. Again, the muscle injuries do heal up predictably and relatively quickly, and usually can get back to doing everything you want to do. And then even if it requires us doing surgery on that tendon as it inserts onto the pelvis, I believe that we can get you back to being just about as active as you were before this, even if it took a surgery to do so.